A year and a half ago, Tamika McRae was nearly 300 pounds. Daily, she took pills and insulin to try and control her type 2 diabetes. But it was getting worse. As a last resort, she underwent weight loss surgery. When she left the hospital 4 days later, before any major weight loss, her diabetes had disappeared.
That was the crazy part. I didn't understand that. When they came in and they checked it, my sugars were nothing. I left the hospital on no medication.
She's now lost 100 pounds. The diabetes is still gone, along with all the medicine.
And I haven't been on anything since.
Dr. Francesco Rubino operated on Tamika. He is the chief of metabolic surgery at New York Presbyterian Weill Cornell Medical Center. Rubino co-led a study published today in the New England Journal of Medicine that gives clear proof that weight loss surgery can reverse and possibly cure diabetes.
For a long time, surgery has been bariatric surgery has been seen as a last resort for treating severely obese patients, and primarily has been seen as a weight loss intervention. I think the studies being published this week and the research that has led to those studies basically suggests we should regard surgery as a diabetes treatment, not as a weight loss intervention.
Rubino says surgery should be offered to more people with the disease, not just as a last resort. He says this could lead to a big leap in understanding diabetes.
The stomach and intestine are not just a conduit for nutrients, but is basically an endocrine organ that controls metabolism very powerfully. So when you change the anatomy of this organ, you change the way hormones regulate metabolic pathways, and therefore results in improvement of body weight, diabetes, or glycemia, and many other things.
Weight loss surgery is relatively safe, but like all major surgery, does have risks, such as bleeding and infection. And there can be complications after the surgery, like malnutrition and hernias. Ted Chaffrey, Associated Press, New York.